I'm Dr. Rajendra Patil. I'm practicing as an intervention cardiologist from last 12 years, and I have been working with ONP since last more than 3 to 4 years now, as I remember. ONP was I started working with ONP as it was a very good platform to start with, and the ICU and the other specialties associated with the ONP and the infrastructure was very good, so that I can deliver better care and take care better care of my patients, and that's why I started with ONP. Intervention cardiology starts whenever you can say whenever there are blockages in the coronary arteries. Like coronary arteries, what we know is that heart also is a pumping structure, and heart itself require blood to pump so that it can work properly. So, and the oxygen is supplied with the blood supply, of course. And the arteries, the blood vessels which supplies to the heart itself, they are called as coronaries. So, if there are blockages in that vessels, the heart muscles cannot work properly, and when there are blockages and they cannot work properly, they can give symptoms just like kind of chest pain or sweating, or whenever you get early tiredness on exertion, then it is called as angina. This is one. Second, we know that most commonly heart attack. So what is heart attack is like whenever the blood vessels they clot 100%, there is a blood clot, and the flow stops abruptly to the blood vessels, and the blood heart has to function without oxygen working reaching to them, and that is called as heart attack. So in that situation, normally the thrombolysis is given like kind of blood thinners, but after that, to remove that blockages, you need an some procedures like an coronary angiography, followed by, if required, an angioplasty or bypass surgery. These are the field which is called as intervention cardiology. This is one part. Second part comes like, as we know, there are four chambers in the heart. So sometimes there are holes in that chambers. So if that holes are there, then we need to close it mechanically. They are called as device closures, and pediatric cardiology also comes along with that. Then the third part comes is like an electrophysiology. As we know, there are blood supplies to the heart, as well as there are electric supply to the heart. So heart has to function sequentially, like upper chamber followed by the lower chamber. And if this sequence is damaged because of electrical disturbances in the heart, they need to be checked and recorrected, and that is called as electrophysiology. So these all three kinds of model of treatment, they all come in intervention cardiology, and which are very well taken care at ONP from last more than 4 to 5 years. It has been working successfully. Possible causes, it's normally said that the person who has got diabetes, blood pressure, hypertension, a strong family history, these are the person they are more prone for having these kind of diseases. But along with that, the recent factor which has been recently what we are seeing is increased amount of stress, lack of exercise, lack of sleep, and these kind of symptoms, they are this kind of risk factor also predisposes a person for this kind of heart diseases. There are quite a few. The first one which I would like to share is first of my grandmother only. She was a heavy diabetic from last many years and having multiple blockages, and was refused for any intervention for last many years, having angina. And then way back in 4 5 years down the line, I treated her with the rotablation, which is a special technique in catheter angiography, and she is living very well. So I think that is one of the best success story, that when you treat your own relative with such kind of thing, and they are happy with your treatment, no complications after that, I think that is one of the success story it comes. Definitely, like this is a very evolving field. Like 5 years down the line or 6 years down the line, angioplasty was supposed to be one of the thing. Then the come electrophysiology, then come the pediatric surgery, pediatric cardiology. So you need to keep updating yourself all the time. So most of the us are like our colleagues, that we normally spend 1 to 2 months of having a new technology which is coming, the new modality of treatment, new modality of any investigations. So there are multiple CMEs which are conducted by CSI or TCT, and this kind of cardiology society, they generally teaches you, and sometimes you have to go the other places to learn the techniques and then come here and practice. Latest technologies regarding cardiology, there are many. As I told already, there are 3 branches and there are subspecialties which are coming. So if I restrict to one of the main, my subspecialty is like doing a complex coronary angioplasty, like rotablation, which I did with my grandmother. Like it normally it was said that if it is a very much calcific blood vessel, then the angioplasty was not possible. Even the bypass become difficult because you can't put stitches on the blood vessels with the calcific thing. So with this rotablation, you can remove the calcium inside the blood vessel, and the angioplasty can be done with very good success rate. So these are the things. Second, it come like TAVI. TAVI is like, we know that right now, till now we know that the valves which are damaged, it has to be replaced by surgical procedures only. But recent years has coming like you can replace this valve with the intracoronary kind of thing. Without surgery, it can be replaced. So the trials are going on, and India it has started. I think last year only it was started, and probably we will have the recent soon in India in Pune. It has been done in very few centers right now, which are very well regulated, and it has not been opened as a treatment yet. But I think it will start because expertise is going. We are taking the trainings for that, and probably in the recent soon future we will start in ONP also. The latest trend in medicine is basically it's kind of collaborative medicine. Like look, like I am an intervention cardiologist, but I also need, okay, procedure is done, but after that to take care of that procedure the patient has to be very well. So it has to be collaboration with the physician, with the psychotherapist, with the physiotherapist, with the dietitian, nutritions, even the family members also. So all this collaboration which is going nowadays, that matters, and I think this all collaboration things make treatment much easier, much better, and much last longer. Definitely, there are some social responsibilities for us because we belong to this society and we have to give it back to this society. The things what we can do is, look, offering free treatment is something that everyone will say or everyone thinks of, but it's not about the free treatment. The correct treatment needs to be delivered. Second, the treatment which has been the reasonable cost, because it has to be matched with the criteria or the cost of new things, the new technologies, along with the our scenario. It has to be mentioned, and of course there are some camps and these things what we do, and I think in ONP we are doing quite much of social things like in pediatric surgery and angioplasty and bypass, which can be done with the our social department is very good active in that, and the numbers I am not sure, but they are at least done 15 or 20 of surgeries last year with the taking help of the other institutions which help normally poor people for that. Health is good, then you don't normally need us. First, first and most, when I started, I told you all the risk factors which like diabetes, blood pressure, family history, these are the things are there. But then what I mentioned was the increased amount of stress is one of the most important kind of risk factor which is coming on. So that stress, it can be a social stress, it can be your financial stress, it can be your work stress, it can be anything. But the stress is the thing that has to be relieved. That is one of the most important thing. So the stress buster, it's like you have to enjoy your life basically. Either you can do reading, jogging, whatever you want. You can relieve your stress along with that. Second, the right nutrition is also important. The right diet, uh, proper diet, proper exercise, proper sleep. These are the most three important key factors for the good life. And if these three are maintained, then normally doesn't need any interventions or any kind of medical help. I'm Dr. Rajendra Patil, intervention cardiologist, ONP, Pune.